Hey guys, welcome back to allornonelaw, and this is a quick OBGYN, and today I'm going to talk about bacterial bacterial vaginosis. This is very important topic for medical students and for USMLE appearing students. Very important. Okay. So bacterial vaginosis, remember the most important point for this is it's not an infection, okay? It's not at all an infection. It's rather what you call alteration in the concentration of the normal vaginal bacteria. Okay, if there is an alteration in the what you call normal vaginal bacteria flora, then this what you call bacterial vaginosis results. Okay. So remember, it's the most common 50% of cause of for vaginal complaints in United States. So 50% of the patients complains of this. So it's the most common. Okay, right? So remember what happens in this is the normal predominant lactobacilli. Lactobacilli, they are present in the vagina, are replaced by massive increase in the concentration of anaerobic species and facultative aerobes. Means anaerobics and facultative aerobes. They come in, they start living with the lactobacilli. Okay? Remember, it is frequently seen in a post-menopausally because of low levels of estrogen. Because estrogen is low, okay, because of the low estrogen, that's why it's seen in the postmenopausal woman. Okay, postpartum can be on around 53 years. Okay, it all depends, right? It changes. So remember the important point on this for USMLE is it's not a sexually transmitted disease, okay, but it is associated with the sexual activity. It's not a sexually transmitted disease, but it is associated with the sexual activity. That's very important. Okay, what are the symptoms? What are the symptoms? The most common complaint is a fishy odor. Fishy odor, okay? Itching and burning are not present. Remember, fishy odor is a really very important point that you should look in the case scenario of your USMLE. Fishy odor is really very important, guys. Okay, the speculum examination, the vaginal discharge is typically thin, grayish white. Okay, no vaginal inflammation is noted. So no inflammation, vaginal inflammation is noted. Only vaginal discharge is typically thin and the grayish white. Okay, and the very important point over here is vaginal pH is more than 5. Remember, what's the normal vaginal pH is less than 4.5. It's acidic, okay? It's acidic. So if it's more than 5, then think is there might be chances of bacterial vaginosis, okay? And another one test that you should remember for USMLE is a whiff test. Whiff test is elicited when KOH, okay, KOH is placed on the discharge, okay? They take a slide, they put the drops of vertical discharge, and they put the drop of KOH, they look under the microscope, and this is what they see. So what is a wet mount? Okay, wet on a wet mount. It is a really very important point, guys. So microscopic examination reveals what we call the cells, typical cells known as the clue cells. Okay, these are normal vaginal epithelial cells with normally shaped, sharp cell borders obscured by increased number of anaerobic bacteria. Okay, and the WBC are rarely seen. Remember. Now, what's a triad for this? How do you remember what's a triad? The three things that you should remember about the bacterial vaginosis is vaginal discharge pH more than 4.5, sometimes above 5. Okay, and the 4.5 is normal, right? So more than 4.5 is she might be having this bacterial vaginosis, fishy odor, okay, and the clue cells, okay, right? So how do you manage this? How do you manage? Okay, treatment is by, remember, is metronidazole or clindamycin. Either it can be given orally or vaginally. Okay, the metronidazole is safe to use during pregnancy, including the first trimester. So it doesn't matter in which trimester she is. If she has a developed bacterial vaginosis during pregnancy, then you can give metronidazole. Okay, guys. So this is about bacterial vaginosis. Thank you so much for watching this video. Take care.